Hello, and thank you for joining me today. My name is John Ripp, and I'm the Senior Associate Dean for Wellbeing at the Icahn School of Medicine at Mount Sinai and the Chief Wellness Officer for the Mount Sinai Health System. I'd like to speak with you today on behalf of my office, the Office of Wellbeing and Resilience, which is located within the Office of the Dean, Dr. Dennis Charney. Obviously, like for all of us, everything changed dramatically as the crisis began to unfold. What I'd like to share with you is a little bit about how that evolution of change happened and where we are today and what it means for our learners and our faculty here at Mount Sinai. So maybe about 6 weeks ago or so, when those first cases started to come out here in New York City, everybody realized that things were going to be changing a little bit. And maybe a week or so after that, when we realized that everything was going to have to go on pause, we actually realized that we could have a really central and critical role in the response to the COVID crisis. Never was it going to be more important than now to address the emotional needs and the emotional well-being of our students, of our residents, of our faculty, of the entire healthcare workforce. And so we began to ask the questions about what is it that you need, and so it began to evolve over time. But certainly at the beginning of the crisis, it was clear that we needed to pay attention to basic needs. We needed to think about how people were going to get to work, get to the workplace, get to if they were residents, if they were faculty involved in frontline work. How are they going to get there? How are they going to get their next meal? How are they going to stay safe? How are they going to ensure, how are we going to ensure that they had the protective equipment they needed? How are we going to give them the information they needed to protect their loved ones at home? And so we focused very much on partnering across the health system with those groups that could address basic needs, and created a huge amount of information, put that on our website, and distributed that far and wide. We also recognized the really important need for communications. Much of the stress and anxiety that we experienced was related to uncertainty. And so partnering with the communications effort through the health system, we began to ask the questions of our constituents. What were the things that they were uncertain about, or that they had questions about, that was leading to stress and anxiety? And in so doing, we gathered a lot of helpful information that we could then bring back to leadership, and that could then be addressed either in communications in relative real time, or through actual changes in policy to address those concerns. And then finally, we partnered with our Department of Psychiatry, our Employee Assistance Program, our social workers, to enhance the existing and robust psychosocial and mental health support that was already in place, and further develop initiatives to address those concerns, because it became clear that the stresses that our frontline clinicians, our residents, our faculty were unlike anything they had experienced before, being redeployed to places that they were not used to working, and seeing an extent of death and dying that they just hadn't seen before. What I will say is that while there has been an uptick in the utilization of these mental health and psychosocial resources, what we recognize is that in large part, our students, our trainees, our faculty are somewhat in survival mode right now, just getting through this difficult time. We anticipate that as things calm down a little bit and people have a chance to process what they've been through, that some of these psychosocial stressors and emotional stressors will begin to take a greater toll. And we're naturally concerned about PTSD, as well as some of the precursors to PTSD. And so the dean has announced that he will be supporting a PTSD and resilience center to address these potential outcomes that our workforce will experience. And that's a process that's underway and will continue. So I just want to finish a little bit about you, talking about you, as you are our alumni. You are likely in a position where you may be involved in frontline care. or connected to people who are. And so now more than ever, it's important to pay attention to your own self-care. This can be extremely difficult in times where you're really busy, but to the extent that you can, it's important to attend to your own basic needs, to your own self-care. We know that at times like this, it's really important to lean heavily on your own support network, which is essential to do so. And when you can recognize the value of your work and the enormous impact that you have, there's actually the potential for you to have post-traumatic growth as opposed to post-traumatic stress. Many people who go through situations like this, some are affected in a negative way, but many are affected in a positive way because you've seen the impact of your work and the value of what you're doing. So to the extent that you can, if you're able to frame things in that perspective, it will do you well. And so lastly, I just want to finish by saying that we could definitely use your help. We've never seen such the needs so great as it relates to the emotional stressors that our workforce, that our trainees, that our students are experiencing here in New York City at Mount Sinai in the epicenter of this crisis. And so the efforts that I described to you, many of those can be supported, expanded, facilitated with the support of our alumni and donations. So we encourage you to go to the website, to look for those links and support these initiatives. We know that they're going to be needed for a long time to come because many of our workforce will be impacted by this, not just now, not just in the weeks to come, but the months and even the years. So any support you can give will be graciously appreciated. And with that, I want to thank you for listening today and wish you well. Take care.